All right, everybody, take a look at those temperatures, and boy, was it nice over the weekend. But did this weekend's great exposure, actually I should say great weather, expose your tummy troubles? Well, if no amount of dieting or exercise can give you the results you're looking for, perhaps Dr. Sam Shatkin Jr. can. Tummy tucks, liposuction, and thus is the subject today, and your calls are welcome at 644-9840. So good morning, how are you world traveler?
Thanks.
You should let people know you just came back from Europe.
Yeah, It was wonderful. We had a great time. And, you know, one of the things that I appreciated over there was the beautiful sculptures. Michelangelo's sculptures were so tremendous. And I think what I do, certainly I can't compare myself to the talent of Michelangelo, but I can appreciate, you know, what sculpting is. And we do a lot of that with liposuction and body contouring. And we'll talk a little bit about that today.
All right, I love it. I think that's a great idea. And no doubt, and pardon me, I'm going to sneeze. It was the pepper. Excuse me, it was Barb's pepper in those eggs. Sorry to everybody, thank you. I think everybody right now getting into shorts or capris or whatever it is, skimpier clothes, lighter clothes, it's revealing the issues we're having.
Right.
And like I said, you are a firm believer in diet and exercise first.
Well, you know, anybody that comes to me that feels that they need some shaping, some liposuction or body contouring, I always talk to them about their diet, make sure that they're on the right track and their lifestyle changes are done appropriately so that they can be healthy. Because it's not just what you see on the outside, it's what you feel on the inside. And you need both to be successful with surgery. So we talk to them first about that, but then when they usually understand that, they get their body weights down a little bit, then we can do the liposuction, which is perfectly geared for localized areas of fat.
Right, because you're going to get a better result.
Exactly.
Okay, tummy is probably the #1 area. I'm guessing.
I do a lot of tummy tucks.
Yeah.
A lot. We do a couple a week, and it's a very popular procedure, and generally the recovery goes very easily, so the patients like it.
Now, tummy tuck is for those who need more than just liposuction.
Well, you know, the thing is this, if you've got loose skin, liposuction is not going to tighten that up. So if you need some skin tightening, then we would consider the tummy tuck or a combination of a tummy tuck and liposuction. But if they've just got areas of localized fatty deposits, then liposuction may be a good choice if they don't have the loose skin.
Okay, I think we have some pictures.
Good.
Because
let's go to the photos.
As we're talking a little bit about tummy, we can let you know that this actually, it can work on other parts of the body as well.
Yeah, I just want to mention first, some of the pictures are my photos and some are the American Society of Aesthetic Plastic Surgeons, which I'm a member of as a board-certified plastic surgeon. But this is a perfect example of a tummy tuck. And the scar is hidden underneath that bikini line, so you really don't even see it on these pictures afterwards. So you get the before on the left side, the after on the right.
Wow, that's an amazing before and after.
And for the women, the mommy makeovers, and next month we'll talk a little bit more about that for Mother's Day. But you can really see a dramatic tightening of the muscles underneath the skin that get loosened from those pregnancies. You got to remember, you know, you got a 30 or 40 pound gain during a pregnancy, and all that weight is pushing against those tummy muscles.
Okay, 30, 40 pounds, you're being very generous.
Yeah,
Thank you very much. All right, so here's another great example
from the side. This is a side view showing the shape and the flattening of the tummy. It can really help a lot, you know. And then now here's a good example of liposuction. This outer thigh area, the saddlebags as some people call them, can be very dramatically shaped and softened and made look a lot more, you know, feminine, more shapely, and patients love these types of results. And it's a surgery that takes about 1 to 2 hours. The recovery is fairly easy. They go back to work within a couple days. Sometimes a long weekend is all they need, depending on their type of work, obviously. And then within a couple weeks, they can be back out and about with shorts on without having the swelling. There's another example of a tummy tuck, a patient that I did. Good before and after picture, and just see that tummy flatten down, the waistline looks more shapely. When we tighten the muscles, it brings in the waistline as well, and it really looks great.
So that's part of the tummy tuck as well, is tightening the muscles underneath.
Absolutely. Some women don't have a lot of extra skin. They just have that loose muscle, like this woman here. She didn't have a lot of hanging skin, although we do see that on many patients. But if those muscles are loose, you got to flatten those down and tighten it up, and the results can be very dramatic.
Wow. All right, we have a phone call, and I knew we would. Hello, welcome to the show.
Hello.
Hi, we can't hear you in the studio, so I'm going to relay your question to Dr. Shatkin. Hello, go ahead.
Okay, I have more of a comment. I had it done, and I absolutely loved it. It was the best thing ever.
Oh, good.
There you go.
You had the tummy tuck done?
Yeah, I had liposuction on my stomach. I had it on, like, the back of my hips and on, like, above my rear end. And that, I tell you, I have exercised, and it would never go away. I couldn't even zip my pants. It was just, that's how bad it was. I have to buy bigger sizes, and it was horrible. And the best thing I did a year and a half ago, and I would recommend it to everybody. And people are scared, go for the consultation because it's the best thing you could do.
There you
Okay.
go.
Well, thanks for that nice testimonial. You know, we hear that from a lot of patients. You know, they're all very pleased with the change in the shape, and sometimes it's that localized fat that you just can't get rid of, and no matter how hard you try. And I've had people that come in that are aerobic instructors, exercise therapists, and things like that, and we just can't get that weight down.
You know, it's interesting too, because as we're watching some of these pictures, you can have liposuction. It can be very effective on different parts of the body, not just the stomach.
Right, right. Well, those are the most popular, the stomach and the saddlebags, but a lot of times, especially with the summer coming up, we'll work on the arms. And with a small incision, which is only about 1/4 of an inch, right by the elbow area, we can flatten down and take away a lot of fat in the upper arm and make that very shapely. And the patients really like that, especially if they have a lot of heavy-looking arms. And some people, that's the only area it localizes, and the rest of their body looks nice and thin.
And men can have that done for their upper body.
Men, we can do
right?
it on male chests, you know. I remember one time, a couple years ago, we showed the men pictures on there, and someone thought that they were female pictures.
Right,
and
right.
We have to be careful about showing female body parts on the, on the show. But this was a male that just had like a B-cup breast, and with liposuction and using the ultrasonic liposuction, which are the new technology machines, we can remove that fat, shape the body, flatten down the chest for the men, and they can be out on the beach within a few weeks.
Right, so it's like self-esteem issues for some people.
Exactly.
We have another phone call for you, Dr.
Great.
Shatkin. Hello.
Hi.
Hi.
I was calling to find out about my husband. He's just had that gastro bypass, and he's on a blood thinner, okay, because he has a problem with blood clots. I'd like to know, would he be able to get something done about, you know, his chest area?
Right, that's a great question.
Yeah.
You know, we work with the family physicians, the primary care physicians, to help discuss, you know, what would need to consider for somebody undergoing that surgery. Blood thinners are a problem when you're doing a big operation like a tummy tuck or a body lift operation. So usually we try to get that to be stopped at least for a short time before and a short time after the surgery. But best thing to do would be to have your husband make an appointment, come in, let's evaluate, you know, what his conditions are and see if he's a candidate, and then we can discuss things with his primary care physician.
Right, because you notice that when you see a lot of real dramatic weight loss, you're left with the skin that's stretched out.
Right.
And a lot of people will go ahead and have a surgery down the road to have all that taken care of. So you know that down the road you can
well,
work
these
with that.
people are much healthier now that they've lost all the weight, but more so now than before. People are losing the weight on their own. They don't need a gastric bypass or stomach stapling type procedure to lose the weight, which is tremendous because that's a more healthier way to do it. You don't have to undergo an operation. And I've had people lose, you know, 75, 100 pounds on their own with good diet and health changes, exercise, and nothing else. And just getting back to the basics of what we want to do to help our bodies.
You know, we should let people know, too, with Mother's Day right around the corner, maybe this is something that mom's considered or mom would like more information about. It's be a great time to go in for that consultation.
Mommy makeovers, absolutely.
Mommy makeovers, yeah. I mean, why not? But, you know, the weather does, we stay so cloistered for, let's face it, 6 months out of the year. And sometimes it's a shocker the first time you put on those shorts. And, you know, and people will be frustrated because for a lot of folks, they are diligent when it comes to going to the gym. But it's a genetic thing. And so, that happens to a lot more people than you think. So if that's your problem, that is something that is,
you know, we do that. We do that also in conjunction with hair removal too. We have lasers and intense pulse light hair removal in the office, and a lot of patients, if they don't want to wear those shorts because their hair is a little thick or coarse and they have to shave so frequently, we can do the intense pulse light hair removal on that, and that works really well with the liposuction.
It sure does. All right, everybody, take a look and take a listen. 2500 Kensington Avenue is where you'll find the Aesthetic Associates. That's Dr. Sam Sr., Dr. Sam Jr., and Todd, who works on the cosmetic dentistry part of this. And believe me, talk about mommy makeover, head to toe. 2500 Kensington Avenue in Amherst. Give them a call today at 839-1700 if you have calls, questions, or concerns. These folks can help you out and really, really create a wonderful spring and summer and the rest of your life to come. You'll be as beautiful on the outside as you feel on the inside.